Good morning, everybody. I am so privileged and honored to have Dr. Deshmukh with us today. Nobody, I'm sure everybody in the city would know about Dr. Deshmukh. Over 40 years of his experience of Sunflower Hospital. He is also called as Doctor's Doctor. He has also been a chief doctor for governor, for the post of governor a few years back. And there is so much to learn about him. So thank you for taking time out of a busy schedule, sir.
Thank you very much.
Thank you for being here. I want to start, sir, a little bit of your background and how you started Sunflower Hospitals.
Oh yeah, first of all, thank you very much for having me over here on this beautiful Sunday morning, and I'm really privileged to be with you. Yeah, my story starts almost 40-50 years back when I had my schooling from Hadas High School, Nagpur. I was a pretty good student, meritorious you could say as well. Then I entered pre-university at Institute of Science, where I stood first in the B section, that is biology. And then my father went to Mumbai, so the whole family shifted over there. So at Dadar, you have Dadar Matunga, there is one Ruya college, wherein we entered that college at Inter-Science, which is now known as 12th standard. And then I got into Sion Hospital as an MBBS graduate and was there for 4.5 years, an internship, did my MD and MNMS, then MCPS, FCPS, got the lecturer's post there. But it was decided by everybody in my family, including me, that I should go in for private practice. So I chose Nagpur. I'm here in front of you.
So over so many years of your private practice, sir, I want you to decode how internal medicine has evolved ever since your early days of getting into medicine to today in 2025.
I think that's a very interesting question. Internal medicine has evolved in a very big way, though it had its ups and downs. The downs were basically because of newer and newer super specialties coming in, and suddenly all those who are on the internal medicine side thought that they had no importance or they had no relevance or they are irrelevant in practice or patient care as a whole. Because a little bit of chest pain, people used to go to the cardiologist, headache, neurologist, joint pains, rheumatologist, and this is also true for in some instances in Nagpur as well today. But then people started realizing that, well, you need to know somebody who is a physician who would look at you from head to toe, right, including your spiritual health, your emotional health, your diet, your exercise, and all the metabolic factors. As you know, doc, that metabolic factors are catching up very fast, and the emotional health. So now we are laying also more of emphasis on internal medicine. The most important change that has occurred in internal medicine is the technology. Earlier to this, it was all clinical medicine, but now we have CT scans, we have MRI, we have PET scan, we have all endoscopies. You know, there is no part of the body which is left which cannot be evaluated properly besides the physical examination from me or from any internist. So I think it has evolved. But however, internal medicine has its own huge challenges, the history taking and physical examination. I hope we'll discuss this later.
Right, sir. But also the medicine is involved, but over the years you must have seen evolution in patient expectations and disease patterns has also changed. So please throw some light on that.
Oh, sure. Then I'll answer your second question first. The disease pattern has changed. Earlier, when we were medical students or house officers, we used to see patients of heart attack at the age of 40, 50. Now, believe me, just a week ago, I saw a patient of heart attack who was just 24 years old. And before that, I saw a patient of brain hemorrhage with a paralysis who was 23 years of age. And they had no comorbidities. That means they did not have any family history or they did not have any hypertension or diabetes. So this has evolved. So what we were seeing earlier at the age of 40 and 50, we have started seeing people at the age of 30 and 40. In between, in my journey of internal medicine, suddenly this HIV came, AIDS. So that was a huge challenge, right, in diagnosis, management, and the social stigma attached to it, and the availability of medicines which were very expensive initially. But thanks to many things, including the government policies, things have changed. Then what has also changed over the period of time is diabetes, hypertension, and lifestyle disorders. We are getting them at a very early age, 18, 20, 21. This is because of the fact that we are more on our coaches and our beds, on our chairs, and we hardly move.
Sedentary
and
lifestyle.
it's a very, very sedentary lifestyle. You're all vehicles. You don't go to a hotel instead. Somebody gets you food in your house, and the walking part is very less. And the demands of the society. I mean, there's so much of competition that more you study, the more you work, the more successful you become. But that is coming at the cost of neglecting your physical health, and that is, I think, a great burden for India now. A very health issue which needs to be addressed properly at a very young age.
Sir, about patient expectations, sir.
Well, I think that point I missed. Patient expectations are also becoming very high. That's good. That's good in one way, that the doctors are on their toes and they try to give their best.
Right, sir.
But the flip side is that the patient's expectations are based on Google information or ChatGPT information, wherein they know only a few areas of the health profile of the patient. They wouldn't know that every patient is a different patient. Two people with the same blood pressure, which is high, would have a different form of therapy given by the medical expert. So I think one size does not fit all in medicine, and it's very challenging. Every human being has different genes. His response to drug therapy is different. His manifestation of disorders is different, and I think you should not compare your disorder with somebody else, saying that that patient had cancer and he got well, and I'm having cancer and I'm going to die in 6 months. That doesn't hold true anyway.
Right. But before you mentioned, sir, you just diagnosed, you saw a patient 24 years old suffering from heart attack.
True.
I recently saw a 20-year-old came to me in the OPD with complaints of headache and eye pain. I checked the intraocular pressure, that's what protocol suggests. Perfectly normal. Dilated fundus examination, it was grade 2 to 3 hypertensive retinopathy. We checked his blood pressure with what we had. So the blood pressure was documented 180/110.
Oh, that's very high.
For a 20-year-old chap. And immediately we referred him to whatever his physician was. But it was really alarming for us to see this happening at a very young age, sir.
I think I fully endorse what you say, and this is a very common thing, and this is hugely challenging. I tell you, doctor, 3 important things here. That one, there are many disorders which are silent in the body.
Right, sir.
That means, say, you have hypertension, you have diabetes, you have high cholesterol. You don't have symptoms for a very long period of time.
Right.
And therefore, periodic health checkups, maybe at the school level, at the college level, at the employment level, are absolutely must. And if they are not happening, then every individual after the age of 9 or 10 should undergo an annual health checkup. And you'll be surprised to know, even at the age of 10, I would advise you to go in for cholesterol, blood sugar, and blood pressure checkups.
Right. Some memorable technological and diagnostic milestones you have observed in so many years of your practice, sir.
Oh yeah, there are so many to count really.
Right.
But let me just be
From
brief
the
on
top
this
of your
issue.
head.
Yeah. But something which is really been astonishing is simple things, that the manual element in complete blood count, ESR, all the blood tests has become totally computerized.
Right.
So the margin of error has become very less, and you'll appreciate that these tests are done in almost all patients, regardless of what specialty you're doing.
Right, sir.
A. Number two, hitherto we were just relying on X-rays of the chest or abdomen. Now we have progressed further, and we are doing CT scan of the chest, we are doing CT scan of the abdomen, we are doing MRI, and so on. If you have a person with chronic cough, you're doing bronchoscopies, and you have video bronchoscopes, then you have colonoscopes, and there are so many of them to narrate really. Now there are studies on the genes, we are studying the chromosomes, we are doing the sleep studies, we are doing the coronary angiographies, we are doing CT coronary angiographies, we are doing lipid profiles. So we are just relying on cholesterol levels to 30-40 years back, and now there is a whole plethora of investigations, and this has really helped the doctors to treat their patients better.
Right, sir. Actually, what we are seeing in the world of ophthalmology, we are going towards what is called as predictive analysis of diseases. So we can actually take your fundus photos with certain equipments, and we can do a predictive analysis that if you don't keep in check 1, 2, 3, 4 cheezein, you will probably end up in something like glaucoma or your hypertension or diabetes. We can actually document this, sir.
I think what you are exactly telling me is about artificial intelligence.
Right, sir.
And artificial intelligence has entered the field of medicine in a very big way. Now, just to give a few examples, female patients are worried whether they could get cancer of the breast. They just get their mammography done. Right. And on the basis of mammography, even if it is showing some borderline thing, the radiologist can tell you or predict whether that particular lady is likely to get cancer later on.
Right.
In Mayo Clinic at Rochester, USA, which is one of the best hospitals in the world, some sort of innovations are taking place wherein just looking at the ECG, they can predict whether the person's left ventricular function is adequately functioning or not,
Wow.
whether that person is going to get a heart attack or not, and probably what his longevity would be. So artificial intelligence is gradually creeping in all fields of medicine, and I think that is the future of medicine.
Right, sir.
But however, let me tell you one thing, that we should not basically forget our clinical medicine.
Absolutely.
That has to be there, history taking, because otherwise tomorrow robots also will start treating patients, and patients are not going to get satisfaction due to that.
No, empathy is very important.
Empathy is
sir.
very important,
Right.
absolutely.
Moving on to the next topic, I want to ask you, sir, how has your experience been as an honorary physician to governors over so many years?
I think, to be very honest, I don't like to treat VVIPs, to be very honest. That was just an honorary post to me. I happened to see him and his family members 3-4 times, and I guided them. They appreciated my help, and it was a wonderful experience, let me tell you that. Again, we believe that they are doing very well, but there are a lot of many stress factors. You and me know as doctors that what our future is likely to be, but they are basically politicians. They have a very limited shelf life as well, so they are under stress all the time.
But sir, what are the ethical challenges that one needs to deal with while treating such VVIP patients, sir?
Well, I think ethical standards would be that you treat them as any ordinary patient. Don't allow them to believe that they are VIP patients.
Okay.
Because what really happens is a little bit of barrier takes place between you and them, and you may not be able to elicit a proper history from them.
Right, sir.
So you treat them as ordinary patients, treat them the way you would be treating any other person, in depth, in details, document everything, write on the paper, and give your very honest opinion. If you are feeling that, you need to take somebody else's advice, be free to do that.
Right.
And also be sure that you are not his first and last doctor. He's going to
Right.
consider many more.
So there has to be professional boundaries, and confidentiality is the key, obviously. in such
Absolutely.
cases. What should younger doctors focus, sir, beyond textbooks in coming times?
Oh, well, I think there are two things here. As you say, doctors, they could be doctors in practice, or they could be doctors who are in medical colleges. Now, as I am in practice, let me tell you that first. I think first of all, I always tell my younger doctors that don't run after money.
Absolutely.
Run after patients.
Right.
Give them the best possible. Consider that particular individual is your brother, sister, mother, or father, and go beyond that and treat them. Give them a lot of support.
Money is an
emotions,
outcome eventually.
Outcome. And I tell you, when you run after patients, money runs behind you.
Exactly.
You may be having some loans to begin with. You may be financial crunches could be there, but your time would come. Have a lot of patience.
Right.
Patience is the key for a successful practice. You are not going to be number one overnight, and don't go for number one. Don't compare your practice with anybody else. You should compare, but with whom? With yourself. What have I done last month? How can I improve today? What newer
Right.
technology I am going to embrace now? How my patients could be much more happier than what they were last month? I mean, that should be the approach.
Right. I think over the years, sir, patient communication and some aspect of emotional intelligence has also come in when we as doctors deal with patients. And a lot of these things are, I don't think they're taught in medical schools nowadays, but they should be taught. What do you think?
I
about
entirely agree with you. Well, I think, at MBBS course, there should be one topic or one lecture every week on skill development of doctors. How to conduct practice.
Soft skills.
Soft skills. How to conduct practice, how you interrelate with the other doctors, how you don't criticize them if they are doing wrong, because tomorrow it would be your turn. And how to have good, honest, professional patient relationship. Okay, that is very important. Let me tell you one story. About 30 years back, I had a patient with cancer of the esophagus. And those days, we didn't have much of facilities in Nagpur for radiation. So he said that, look, I'm going to Tata Nagar for radiotherapy. Can you just accompany me? I was new in practice, had some time, so I went with him. He asked me one simple question. Doctor, we always ask you, we are doing this, we are having this problem. Why can't the doctors ask the patients that how they are feeling once in a while? And I got the message. Since then, any patient who doesn't turn up at our side, or his blood sugars are not coming under control, or once he's discharged, who's very sick at home, I make it a point that my juniors or my receptionist or my secretary or myself would contact them on phone and ask them, how are you doing? I hope everything is good for you. And that simple phone call makes a tremendous difference. Their sort of attitude towards whole medical profession changes a lot. So I would strongly advocate doctors in general that let it not be a one-way traffic of communication. You also should go above board. You should also contact, send them an email, ask them how are you feeling, hope everything is all right. Try to solve their problems. That's important.
This is something which I've learned from my father, sir. He says, you are a very good surgeon. Everybody is a good surgeon. But most of us do surgeries at a spinal level after a particular age. But what you should also do, as this is what he has been doing for so many years, that after he's done with his OT, after 2-3 hours, he would take a break for 10-15 minutes. He would call up every patient and, how are you doing? Is there any pain? Should I increase some painkillers? If not, have this food. Just a 5-minute chat. That goes a long way with patients I've seen.
I agree with you, and that is more important than a medicine. That particular conversation with the patient and asking him about his own challenges after surgery, I think that is astonishing help to the patient.
Nice, sir.
That's superb.
I want to reflect upon and know about some mistakes that you made over so many years, and what lessons that you learned and that you would like to pass on to the next generation.
Yeah, I think it's a very valid point, and it would be foolhardy to tell you that I have not made mistakes.
Right.
I mean, there is no doctor who has not made mistakes, but whether to call them mistakes or poor judgment,
right,
or maybe late diagnosis, I wouldn't know. Where there have been instances wherein we have asked patients to undergo bypass surgeries and they didn't go, they went home and they died. That has happened once or twice. Then there have been patients who have had headache, and we thought it was migraine, and after 1 month that we got a CT scan done and that showed to be a brain tumor. But however, one must understand one thing, that all disorders or illnesses don't come with a diagnosis. You have to think many a times.
Right, sir.
And like for example, today only, I have seen a patient with acute leukemia. Acute lymphatic leukemia from Jabalpur, a young boy of 17. The same patient I saw 2 months back. I evaluated him in detail, blood test and bone marrow, and there was just nothing to suggest leukemia.
Oh.
So that doesn't mean that the diagnosis was wrong.
Right.
The disorders or diseases would take certain time to sort of come up in the patient, manifest in the patient. So I won't call mistakes. I think most of the times the doctors, I tell you, they are not genuine mistakes. It's a question of poor judgment, or it's a question of poor communication, and therefore, nobody will tell you that you have done 99 good cataract surgeries over 100.
Right,
but if one thing goes here and there, then
yes.
you are pointed at that, and the 99% good work you have done has less relevance.
All it takes is one patient.
One patient. So
Right,
I think that is a part of life, and I must tell you to young doctors also, if this happens, take it as a part of your profession. Try to dwell upon it and see how you can learn from that mistakes, so that you don't get into trouble later on. But I think this is a part of life. In case you have difficulty in managing a patient, always take a second opinion, third opinion. Even if he's a junior doctor, it doesn't really matter much. So keep your egos away and dwell into the patient and ask for help. That always would minimize the risks involved or the mistakes involved.
Right, sir. Next, I want to pick your brain about the lifestyle diseases and longevity. So what is driving the lifestyle diseases in our country today, to be very specific?
I think, we are becoming better economically, and economic prosperity brings with it disadvantages as well. So you have vehicles, you have cars, you have metros, you have everything around you. But then what is happening is that people are exercising very less. So that is one thing. So 30 minutes of regular fast walking, I think not only improves your cardiac activity or cardiac functionality, but also helps to release happy hormones, endorphins. And those endorphins make you feel happy. Now, there is a very close connection between the mind and your body. If your mind is happy, then the body remains happy.
Absolutely.
And what means by body I meant was your heart rate, your blood pressure, your blood sugars, your digestion, your sleep, everything. So I think exercise daily and be cautious about the diet, be cautious about your weight, and always look at your mental health. Your mental health should be very nice, peaceful, and you should be having good amount of time for your personal relaxation also, and that will make you a good human being.
Sir, but nowadays we are seeing a lot of doctors themselves and a lot of new age startups are promoting supplements in form of magnesium, L-theanines, and a very different range of products. What is the scope of such supplements, sir? What do you think?
To be very honest, they have no role to play.
Right.
Absolutely no role to play. There is just no evidence that if you take magnesium, you are going to feel better. There is no evidence that if you take omega-3 fatty acids, your heart is going to get better or your memory is going to improve. No. I think these supplements are only important if you have a deficiency. Like you have copper deficiency, you take copper. If you have zinc deficiency, you take zinc. If you have had a bariatric surgery and you have a selenium deficiency, take selenium. If you have hypovitaminosis D or B12, take those vitamins. If you are a chronic alcoholic, your B1 levels are low, take thiamine. I mean, that is how it works. But just randomly taking multivitamins, multiminerals, calcium, omega-3 fatty acids, all these nutraceuticals as we call them, it really doesn't help. What really happens?
A lot of people say, sir, sorry for interrupting, it just came to my mind. A lot of people say that when you have black coffee, you should pair it with L-theanine because it helps in a certain way. I don't remember how.
No, I'll tell you. You see, coffee has its own advantages. It increases diuresis, it increases the mood, it increases the alertness. Okay, it stimulates the brain. Too much of coffee for too long a time can cause adverse effects also, like tachycardia, lack of sleep, etc. But there is no convincing evidence at all that all these things. I think the best thing is, why not change the lifestyle? Exercise, diet control, proper 7 hours sleep. These are far more better than any nutraceutical.
Right. I want to talk to you next about, sir, the founding story of Sunflower Hospital.
Oh yeah. Well, I think that's an interesting story. I came here 4 decades ago, and I came here because we had that house. It was a house that time, and there were tenants. So I had a great time, 5 years fighting with the tenants and going to one court to the other to drive them off, telling them that I'm a young 25-year-old doctor who has come from Mumbai for practice and give me my own place. But as you know, it was very difficult. But ultimately, we had to give them lots of money. I had no money that time. I had to take loan to give them money, and somehow they went off. Then we had renovations done. Again, it was very difficult because I could not find a guarantor for my loan. And those days, taking loan for Maharashtrians was not an in thing.
No, yes.
Yeah. So and so people thought that, well, what is he doing? In fact, I am the first professional in my whole 3-4 decades. So they were very wary about being a guarantee for me. So somehow I did that, and then I got them up. And then I spent 20-30 years renovating every 5 years, 10 years, and so on. Then a time came 15-20 years back that this is not Dr. Deshmukh's hospital. I mean, after I go, I would not like it to be known like this. So let me give it a name so that my next generation after that would work under the umbrella of Sunflower Hospital.
You created a brand name yourself.
So then Sunflower, I thought, is a very positive flower. It's a sunflower. It gives you a lot of energy, and it's a positive flower, and it also has a lot of strength. So why not pick that up? So I picked that, and that's how.
But so many years, sir, has it been difficult balancing ethics, patient care, business also?
No problem at all. To be very honest, I have been able to balance this very well. I have never ever compromised ethics at all. If I would have had, then I would have had a 10-story building by this time over there. So I have not done that. It depends on the upbringing. You see, my parents were both PhDs and they came from academic circles. So our needs were very minimal and we were happy with whatever we are doing. And therefore it was imbibed in us that what is important is education. And then the next was looking after people at large without expecting anything from them in return. Maybe it is economy or whatever. And so I'm very happy with what I'm doing now. I'm very happy. I feel very happy about others who have good buildings and good operation theatres and very nice place. I'm very happy for them because that is a sign of progress. But I am also happy for myself that I am doing ethical practice.
Right, sir.
Yeah.
But what would any tips for doctors who are trying to start their own hospitals?
Oh yes, I think twice before starting your own hospital. Okay, think twice. I would rather say that you be a consultant at a big hospital. I'm giving you very
Because times are changing.
Yeah, I'm giving you very pragmatic and all opinions from my heart. Okay, without any prejudice. So do not start your own hospital because it will take away from you your family life, and you will be under stress all the time. We cannot handle say 50 nurses and 25-30 ward boys and watchmen and look after their all problems and the union leaders and this and that. And there are so many licenses that are required to start a hospital that, I mean, you lose your patience and you lose your peace of mind. So that should not be done. Instead, be a consultant at a hospital and work there as a full-timer. To the best of your ability, your earning might be less, but you have adequate time to give it to your family, to your children, and you could have a better lifestyle after that.
But then that brings me to the next question that I'm about to ask you. What is happening to the vanishing family physician that is happening nowadays?
I think that's a good question. Vanishing physicians, family physicians is there because it's both ways. It's because of patients also and because of doctors also. Not many doctors want to become family doctors. They don't feel that that is the right thing for them to do, and they feel that you are not a good doctor if you are just a family physician. You are a good doctor or a successful doctor only when you are a consultant, XYZ, and you are still better if you are a super specialist. I have a very different view on this. I feel that what is important is not what a doctor wants. What is important is what the society and the patient desires.
Right.
That is important. So whenever anybody would ask me that can I become a family, I say yes, because your eyes should not be on the financial aspect. As I said, that you see a patient, see people at large, and money follows you. Okay, there are so many successful family physicians who have done very well in all possible aspects. So I would say that there is nothing wrong in becoming a family physician, but update the technology. Many people have come to me asking me, sir, we are general practitioners, what should we do? I said, you computerized. You have good curtains in your clinic. Put an air conditioner. Make sure that you repaint your consulting room every year. Make sure that your BP apparatus, which has been gifted to you by your father 20 years back, is changed every year. Make sure that you apply paint, varnish, everything, and keep up to date. Okay, so then that gives you a lot of happiness also that you are doing something better, and the patient also understands that the doctor also is a person who has a futuristic plans and attitude.
But since so many years the times have changed, now we are seeing the rise of big corporate hospitals. Is it impacting the personalized care that you were talking about earlier, sir?
To be honest, yes, in a way, yes. Because what happens is that in a corporate hospitals, their demands, needs are quite different. I personally feel that too many doctors get involved in treating one patient. Like your headache, a neurologist is called, and he asks for MRI, CT scan. If you have some creatinine going to 1.5, a nephrologist is called. Okay, if you have some joint pains which may not be arthritis, a rheumatologist is called. So the care is divided amongst many consultants, and the ownership of the patient is lost. The patient also doesn't know whom to approach. Okay, there are 5-6 doctors who are all good doctors doing a good job in their own possible way. But whom do I tell them that this drug is causing this problem? Whom do I tell that I am having swelling of the feet because of this particular drug? So I think the patient should be under one doctor. Let him be a general surgeon, let him be a general physician, okay, or let him be anybody else, and he would refer the patient to others. And he would be the central figure in managing the patient's health issues. That should work better.
I mean, that makes a lot of sense also, sir.
Yes.
It doesn't happen that way, but
it doesn't
happen.
Not
happening.
Yeah.
I want to talk to you next, sir, about your critical care, the patients that you have had, the certain cases that have shaken your core and changed your worldview over the years.
See, there was a patient who had HIV. And he was following me for 20 years and he was doing extremely well, a policeman. And unfortunately, that person was deteriorating because he had cancer. One of the important problems with HIV is cancer. And he was told that you better go home and take the end of life care. So the relatives decided to take him home. So the patient went home. And there somebody said that doctor has already declared him dead. And why he has come home and he's still alive. So that was a major setback because that came in all the newspapers that a living person was declared dead by our hospital and by me. We had never issued any death certificate. And mind you, this was all in the newspapers, and the patient's family never said a word about this to us because they knew what was happening. So I think this is all happens, and this is the price you pay for success at times, I believe. So that after 1 or 2 days, the patient again came to us for readmission. So he said, I said, this has all come in. I mean, we have nothing to do with that. Somebody has just played mischief. But then that was a great emotional setback to me, because
Right,
whenever I used to meet doctors, they used to look at me with good amount of suspicion that what this fellow has done. How can he, at the 30 years of experience, declare a living person dead, and which was never the case. But unfortunately, there were very few doctors who came in support of me. And that was the thing which I felt at that time. And then I realized that in this profession, you have to fight your own battle. And I have realized it the hard way, but then ever since then, I'm very, very careful.
But didn't you sue the people who...
No, these were all press people who wrote all these things. There was no individual involved. And somebody who made that remark, I didn't know who made that, but then it certainly came in newspapers. And some 50 reporters came to me and asked me so many questions. I told them that this never happened. But then, they would always like to print a sensational news. And they printed it the next day. And the third day, they again printed that was not the case, and the patient, etc., was looked after them very well, and so on.
The damage was done?
Damage was emotionally. There were many people who came after second, third day and to see whether I had adequate patients in the OPD or not. Many people asked me whether that has impacted my OPD and my professional life, but it didn't, because people knew me, it would never happen. And I did not tell anybody that, I had no reason to tell others that, we were not a party to that decision at all. But then, that's how life works. So be ready that one day you may be forced to slip or fall, forced to do that. Right. And you have to stand up again and continue with your life.
What is the emotional toll of being a frontline doctor, sir?
Well, I think the expectations of people is very high. So that is one important thing. But it's a huge challenge also. And that gives a good amount of recognition also. You feel happy when the day ends, because at the back of your mind, you know that you have made a rare diagnosis, you have helped this person. At least 5 people will touch your feet every day in the OPD and tell them that you have saved their lives or you have saved their parents' life. So I think that is just an energy which keeps you going. I don't think there are any regrets of being a frontline doctor and so on. I mean, that is a part of life, though I don't consider myself as a frontline doctor.
Right.
I am still on the learning curve. I study a lot, I read a lot, and I don't consider myself as a frontline doctor.
But sir, over the years, have you understood the limits of medicine?
Oh yes, definitely. The limits of medicine are that you have to die one day. So there are 2 realities in life, your birth and your death. But you have to die peacefully, and you should not die regretfully. So I would appeal to all my patients and all my friends and colleagues that make sure that you make a proper will, so there are no complications after your death. Number 2, I would tell them that accept that you are going to die one day and prepare yourself for death. And thirdly, you can make a living will also. This is a new concept which is coming up, which means that if you are having a terminal cancer, I would say that I don't want to be put on ventilator, I don't want dialysis, I don't want higher antibiotics. So you make a will when you're alive that these things should be done when I'm on the terminal side of my life. And that helps, because unnecessary life is prolonged with a lot of torture to the patient and to the relatives, and I think that is not done.
Very true, sir. Just a few more minutes before I let you go, sir. What were your reflections from COVID-19? What does India still lack in terms of public health care?
Well, I think that was a very huge learning experience for all of us, because COVID-19 till that time was never mentioned in any textbook. So we learned treating our patients and reading about it.
On the job, everyone.
On the job. But I am a regular health column writer in one of the newspapers. So 3 months before the epidemic started, I had written 3-4 articles, and that went right inside the interiors of Vidarbha all over. And people, actually the BAMS, BHMS doctors knew that COVID is going to come. So we sensitized people in a way. Secondly, we had 50 indoor patients at a time and 50 OPD patients at a time daily. So the workload was enormous, spending 14-15 hours in practice daily. And we were at a great risk of getting COVID ourselves.
Absolutely.
to tell you a couple of small stories. Almost 1 dozen patients were treating in their cars. They were treated in their cars with our oxygen cylinder.
God.
Many people said that, doctor, we would like to sleep in your veranda, but treat us. But the government did not permit such things. So we used to take the oxygen cylinder in their car and treat them and see them intermittently. That is how it was. Many people died unexpectedly. Many people survived also. Couple of people died who were belonging to the same family. So it was a huge, huge problem. Many people had gangrene of the legs. Many people had that mucormycosis. So we had to interact with our ENT colleagues. But it was a huge challenge, and we had come out of that challenge pretty well. As compared with the Indian context, considering the fact that we are not a very developed country, the way we did during COVID times is fantastic.
Yeah, fabulous.
Fabulous. I mean, the government, the other agencies, the central government, the national state government, and all the NGOs and corporation hospitals did a fantastic job. And the most important point over here was the vaccination. The way the vaccination was handled in a very professional way.
No other country
No
has
other
been
country, free of charge.
done,
And
yeah.
can you imagine our
The
population?
scale at which it has been done.
Population. And initially there was a lot of reservations about vaccine, that they would cause infertility or impotency or this and that. That was all negative publicity. But then people saw people dying in their neighborhood. They at once understood that these vaccines, and I might tell you that those people who had vaccines never died. They had COVID, no doubt, but the intensity or presentation was at a low level and they could make it. So I think that was a huge, huge learning experience about how to diagnose COVID and how to prevent its complications, how to treat the complications, how to have a follow-up, long COVID disorders, as you know, and the results of vaccination and the problems due to vaccinations as well.
So, but if you had to change one thing in the healthcare policy of the country, what would you change?
I think there are two things which I would like to change. I would like that in India, from the top to the bottom, every person, regardless of his caste, creed, religion, age, economic status, should have a health insurance. And the government should float its own insurance company. And those who are poor, below the poverty line, should have no premiums. And those who are rich should be paying premiums. A. Now, the government should come with a chain of hospitals wherein all these people who have these health insurances can be hospitalized, or the private hospitals also should be told that they should be able to take at least 25% of these. So, compulsory health insurance, free premium for those who are poor, and rich people and affording people should pay premium. That is number one. And number two, there should be very, very strict laws about traffic, because many people, almost 10 people are dying in Nagpur every day because of head injuries.
Right.
So you have to look at traffic, then you have to look after drugs, smoking and tobacco. So health issues. And fourth, there is greater sensitization about the need for lifestyle changes. This is what I would suggest.
Reflections of your career, sir, what really mattered at the end of the day?
I think, to be very honest with you, I'll give a score of 10 out of 10 to me. In terms of happiness.
I think everybody would, sir.
Yeah, in terms of happiness and in terms of little bit whatever I have contributed to people at large, particularly my farmer patients who come from Madhya Pradesh and from Bani or Hingangad or Chandrapur or RV or Pulgaon or no matter what. My focus is on poor people who are ill affording, because they are the people who stick to you, and those are people who really require help at all times. So the reflections are that this is one of the best jobs which one could ever have. If God would give me another life and ask me what do I want to become, I would say that just repeat this again for me. I would be very happy doing the same thing.
Would you not like to try some other profession?
Well, it's a good question. In fact, when I was at 12th, I had 3 professions in my mind. First was I wanted to become a teacher, and second was I wanted to become an IAS, and third was becoming a doctor. So when I told my father that I want to become a teacher and teach English, or I want to become IAS officer, he told me that you can do both of these things by becoming a doctor. So I got his point. So you serve people when you do IAS, so also as a doctor you do the same thing, and you can teach when you are a doctor.
You found all 3 in one.
I got all 3 in one, and that was a fantastic thing. And I still remember my father. I lost him when I was very young, at the age of 17 I lost him. But I mean, he gave me many things to learn in life, and I'm carrying those forward with me. I'm very happy with that.
Right, sir. But even after so many years, sir, you have a lot of energy. What keeps you going every day? In spite of your busy schedule, you find time to write articles in papers, you do presentations, CMEs, you teach younger doctors. How do you do this, sir? How do you have this superpower?
Well, I think it's not a superpower, I wouldn't say that. Well, I think it is your interest and your passion. I would always say that if you want to become a doctor, don't become a doctor just because you want to make money or you want to earn some accolades from people at large. If you are passionate about treating a person and making him feel good and healthy, then only become a doctor. Because there are many other professions which will give you more than 20 times money than what you come over here with. So that is one thing. And number two, keep abreast with the newest technology and always move with those people who are better than you and always move with those people who are very younger than you. So with young people, you get that energy and you know what things are going around you. And when you try to be with people who are more successful than you, then you believe that, well, I have to do something more in life to be better.
Right, sir. The legacy that you think you will be leaving behind, sir?
Well, there are two types of legacies. One would be the patient care, and number two would be what my children would be doing. As far as my children would be doing, I think they are in the right frame right now. One is doing a good job in US. He's a cardiologist.
Abhishek.
And Abhishek, he's at Mayo Clinic.
Right.
He's a cardiologist there, doing very many innovative things. And Arjun is working with me. He's following my footsteps, looking at diabetes and other metabolic disorders, and also doing a great job. As far as legacy of patients is concerned, I think they are going to remember me when I leave this world, and I hope they remember me for all the good things that I've done for them.
Right, sir. Final thoughts. Quick rapid fire. Every book a doctor should read.
Discovery of India.
Right. One patient story that changed your perspective.
There was a patient from Akola. She had a pulmonary embolism 40 years back, and she had a young child who was just 4 weeks old, and the patient improved with our care, and she named the patient as Jai.
Oh, क्या बात है, sir? Last one. What keeps you grounded, sir?
Values.
Values.
I've seen that I've come in a tough way when I used to see 2-3 patients per week, and I know how impatient I was at that time, and I thought that I should run away to Bombay again, but I stood my ground, and I'm happy about it.
Thank you so much
Thank
for
you.
giving me your time, sir.
Thanks a lot.
Bye-bye.
Bye-bye.